Imagine a patient recovering from surgery who needs to see a specialist. The medical team is ready and the facility is prepped, but there is a physical gap between the patient's front door and the doctor's office. That gap is the domain of non-emergency medical transportation, or NEMT. It functions as a specialized tier of logistics for people who require physical assistance, serving as a bridge that rideshare apps or standard taxis aren't equipped to cross. When this link fails, the consequences move through the entire healthcare system. A delayed vehicle leads to a missed appointment, which triggers a hospital backlog and creates immediate stress for caregivers managing the patient's recovery at home. In systems built for speed and high volume, patients, often older adults or those recovering from surgery, can be treated like cargo. They are moved quickly to keep a schedule, rather than being treated with the care their condition requires. Because of this, the drive itself is often the most fragile and least accountable point in the entire medical care timeline. SwiftAid Transport was formed to address these failures in Orange County, New York. On June 13, 2026, the company marked its first anniversary. However, after 365 days of operation, the company has not accepted a single ride request or transported a single passenger. Curious. For a business built on moving people, spending a full year refusing to drive raises a logical question. Why stay off the road? Most startups prioritize immediate market entry to generate revenue. SwiftAid took the opposite path, choosing to hold back services to focus entirely on building internal infrastructure. Launching an NEMT service prematurely can create liabilities for patients and facilities alike. By waiting, the company aims to ensure that when they do launch, they have the systems in place to protect the people they carry. Year 1 was focused on engineering a standardized digital infrastructure. The goal was to remove the operational blind spots that lead to late pickups and poor communication before serving the first client. Specific tools for dispatch, billing, and records integrate into a centralized core, ensuring interactions are documented. With GPS planning, families track progress in real time, removing uncertainty. This real-time verification acts against fraud. Every trip is backed by data. In this context, software serves as the structural foundation of accountability, ensuring the company can answer for every mile driven. Beyond the digital systems, the company's people-over-profit philosophy dictates how they manage human interaction. They treat the driver as a trained member of the medical care team, rather than someone who simply operates a vehicle. This requires rigorous onboarding standards. Drivers train in HIPAA privacy, defensive driving techniques, and maintaining passenger dignity. Because NEMT serves a specific demographic, the training also covers physical requirements, like ADA accessibility awareness and the mechanics of safe wheelchair securement. The driver is often the last person a patient sees after a long day of treatment. In those moments, professional compassion is a requirement of the job. Even with the right equipment, there is a significant information gap in healthcare logistics. Many families and facilities struggle to understand exactly what their transportation options are. Patients often face a wall of bureaucracy, from the differences between Medicaid and Medicare coverage to the specific rules of private pay transportation. SwiftAid addressed this by spending their first year building a public education platform, providing answers to these questions before their first vehicle ever hit the road. By simplifying complex systems like New York's medical answering services into blogs, podcasts, and video guides, they've created a library of resources to help the community navigate the logistics of care. This educational work is part of the mission. A community that understands the system is better equipped to utilize it effectively. Today, SwiftAid is moving through its final milestones, focusing on operational testing and the acquisition of a professional fleet. This one-year build-out establishes a baseline of service. By taking the time to prepare, the company can launch with defined protocols instead of the operational excuses that often follow a rushed start. This groundwork treats medical transportation as a coordinated part of a patient's healthcare plan, ensuring the ride meets the same standards as the clinical care it supports. In Orange County, this transparency is how community trust is being established. The work is being done in the open, long before the first passenger is ever picked up. This invisible work leads to a logical conclusion: a safe, reliable vehicle arriving exactly when a patient needs it. Follow SwiftAid's final steps toward launch, explore their educational library, or reach out regarding future partnerships at their website. Reliable care is a matter of engineering. It begins with the solid foundation of the company, long before a passenger ever steps inside the vehicle.